to bring to your appointment: driver's license or photo ID, insurance cards, including any supplemental coverage you may have. If your doctor's office gave you the pre-anesthesia screening questionnaire, please complete that prior to your arrival. Please bring the bottles for any medications that you are currently taking. Don't forget to include any vitamins, herbs, eye drops, aspirin, or other over-the-counter medicines you may take. You will check in at the reception desk and then have a seat in the lounge area until your name is called. A financial care counselor will gather your insurance information and share the patient's rights and responsibilities with you. Next, you will be taken to an examination room in the preoperative clinic. Your doctor may have scheduled a preoperative physical, an EKG, or a chest X-ray. You will be asked for a urine specimen and have blood drawn in preparation for your surgery. You will be given a special soap with instructions to use the night before or the morning of your surgery. This product will help decrease the amount of bacteria on your skin, reducing the chance of a surgical site infection. Finally, you will have a pre-anesthesia interview with a professional nurse. It's very important to let them know if you have any allergies or have had a poor experience with anesthesia in the past. That could include nausea and vomiting after surgery, or perhaps you were very slow to wake up. Before you leave, your nurse will give you a list of the medications you should take on the morning of surgery and other important instructions. You will be called in the afternoon, the day before your surgery, to tell you what time to arrive the following morning. This preoperative appointment is designed to give you the best possible and safest experience so we can get you back into forward motion. The day of surgery has finally arrived. Please park in front of the hospital and enter through the main entrance to the hospital. Overnight bags and pillows can be left in the car for now. You will check in at the ambulatory care unit on the main floor and then have a seat until your nurse comes for you. Your nurse will take you and one family member or friend back into the preoperative holding area. There, your nurse will put on your hospital ID bracelet and a yellow bracelet. Next, you will change into a hospital gown and put on a pair of bright yellow non-skid socks. The socks and bracelet let everyone know that you are at risk for falling due to your surgical procedure. They remind us to pay special attention to you to help prevent you from falling. Your nurse will tell you and your family member or friend what to expect over the next few hours. She or he will also take your blood pressure, heart rate, and draw blood if any labs are needed. The information you provided during your pre-anesthesia interview will be reviewed and updated if you think of any new information. During this time, your surgeon, physician assistant, or nurse practitioner will confirm and mark your surgical site with you. Your nurse may use clippers around the surgical site to remove excess hair. The surgical site and the area around it will be cleaned again with a special product to reduce bacteria and other microbes. During this time, an IV will be inserted so you can receive fluids and medications. Here is where you say goodbye to friends and family. They can expect your surgery to last 2 to 3 hours, but they will be updated several times during your surgery so they know how you are doing. You will now go to the OR holding area. You can expect to meet your anesthesiologist, who will review your history with you to make certain nothing important has been left out. The anesthesiologist will review the risks and benefits of the particular type of anesthesia that was chosen for you. You will be asked to sign a consent form for the anesthesia. If you have any last-minute questions, now is the time to ask. Next up is the operating room. You will be asked again to confirm who you are, what is being done, and which limb is involved. Before you know it, the anesthesiologist has given you some medication in your IV, and you have drifted off to sleep. If you thought the room was busy before, it gets even busier once you have gone off to sleep. The OR staff work together to place you into the appropriate position for your surgery. Your surgical site and the area around it are cleaned for a third time. Other staff members are using sterile technique to open the trays of instruments and other supplies that the surgeon will use. The first dose of an IV antibiotic is given to reduce the chance that you could develop a surgical site infection. When your surgeon enters the room, he is assisted into a spacesuit, which is a protective suit with its own air filtration system. The spacesuit is designed to protect you by remaining sterile even when exposed to blood or sweat. This also reduces the risk of a surgical site infection.
Too tight?
Perfect.
When the team is ready to go, the surgeon calls a timeout before making the initial incision.
Are you guys ready?
Yes, we are. Timeout, please.
Timeout has been called. Dr. Gregory has called our timeout. Our patient today is Dan Lester, consented for a left total knee arthroplasty. We have 2 patient identifiers. Anesthesia, do you concur that?
That is correct.
Thank you very much. The H&P is complete and signed. Everything matches. There are no drug allergies for this patient. We have no risk assessments at this time. Dr. Gregory, do you have any considerations we haven't taken into account?
None at this time.
None at this time. Thank you, sir. And anesthesia?
The World Health Organization, or WHO, has developed this surgery safety checklist used worldwide to improve patient safety. The team introduces themselves and their role, the patient's name, procedure, and the surgical site is confirmed again. The team notes the time that your preoperative antibiotic was given. If there are any special concerns related to you or the equipment, they are addressed at this time. When the timeout is complete, they will begin your surgery.
Do all concur with the timeout as given?
Yes. Yes.
Let's proceed.
All right. All right.
As you begin to wake up, you will realize that you are in the recovery room, or PACU. You can expect to remain here for about an hour to an hour and a half. Family members are not able to be with you here due to HIPAA regulations, but they will have been updated that your surgery is over and you are recovering. In the PACU, specially trained nurses monitor you very closely as you become more alert. They will take your blood pressure and other vital signs frequently, give you pain medication and anti-nausea medication if you need it. You will have oxygen tubing in your nose and be receiving IV fluids. There will be a clip on your finger to monitor your oxygen level and rate of breathing. You may have a urinary catheter that was placed in the OR while you were sleeping. You will notice a large, bulky dressing on your surgical site. Don't worry if you are unable to move or lift your operative leg. That is normal.
Welcome to the recovery room. You're just waking up from surgery. We're going to get you hooked up to the monitors and make sure you're doing okay, and then we'll get you up to your family, okay?
Okay.
All right.
Your PACU nurse will bring you to your room on the orthopedic floor. Your orthopedic nurse and nursing assistant will greet you there. They have been specially trained to partner with you to help manage your pain and meet your other needs as you begin your recovery. You will be offered clear liquids like water, juice, or broth to start with. Don't be in a hurry to eat more solid foods, since they can make you feel sick to your stomach. Your vital signs will be taken every 4 hours for at least the first 24 hours. This does include 10 p.m., 2 a.m., and 6 a.m. to ensure your safety. The phlebotomist may also come and draw blood around 4 a.m. for any tests your doctor ordered. This is pretty early, but then the results are available for your doctor in the morning. The doctor often makes decisions about your treatment based on the results of your blood tests. You can expect your nurse or nursing assistant to check in on you hourly to see if your pain is controlled, if you need to use the bathroom or need a snack or a drink. One of the orthopedic leaders, like the charge nurse or nurse manager, will also check in with you each day to ensure we are meeting your needs. Each day at 7 a.m. and 7 p.m., your nurses will give shift report at your bedside to ensure you are kept up to date on your plan of care. We encourage you to ask questions during your stay and be involved in your recovery. The most important part of your recovery process while you are with us is to call, don't fall. Be sure to ask for assistance to get to the bathroom, to the sink, or to go out into the hallway to walk. While we appreciate family members and friends wanting to help, it is best if our staff helps you while you are here to ensure your recovery gets off to the best possible start.